before treatment, capture a baseline assessment including the patient's pain level on a scale of 1 to 10. Ask the patient to identify activities that are limited by the pain and assess their mobility by having them go up and down stairs, rise from a chair, or do deep knee bends. Palpate the knee to identify painful areas, marking them with an X. Use the marked areas to assess the patient's pain throughout the treatment and again post-treatment. To mark the treatment area, position the patient in a comfortable position with the leg extended. Next, identify the landmarks and guides, such as the lower pole of the patella and the center of the patella. For the AFCN, measure from the center of the patella to the top of the femur at the inguinal crease and calculate 1/3. Measure the 1/3 calculation and mark the thigh. Using the sides of the patella as a guide, draw your treatment line at the 1/3 mark. For the ISN, measure 5 cm medial the lower pole of the patella and mark. Locate the bottom of the tibial tubercle and mark the area 5 cm medial. Connect these two dots to form your treatment line. Using betadine or a similar agent, clean the skin of and around the treatment line. Inject the anesthetic superficially in the subcutaneous layer using shallow injections along the entire treatment line. Use only as much as needed for patient comfort during treatment. The anesthetic can be applied to both treatment lines at the same time. Clinicians can use their preference as to which nerve is treated first. When finished, press out and massage the anesthetic into the tissue. To begin treatment, insert the smart tip and press the main button. A tone will sound indicating the cycle has begun. If you press this button again once the cycle has started, the cycle will cancel. Each cycle takes 60 seconds and a tone will also sound when it's complete. When you see a check mark illuminate, it is safe to remove the tip and move to the next treatment location. Do not remove the tip while the treatment cycle is in progress. A few things to remember as you treat. First, ensure that the handpiece is held perpendicular to the ground and is never more than 45 degrees from this vertical position while treating. This allows the nitrous oxide to flow correctly. Second, always stabilize the skin when inserting or removing the smart tip. This helps ensure that the skin warmer is in full contact with the skin. In cases where excess adipose tissue is present, this is particularly important as the skin warmer may not actually reach the skin despite appearing that it does. During the cycle, hold the handpiece stable, minimizing any movement. When treating the anterior femoral cutaneous nerve, it is clinician preference whether to start medial, lateral, or in the middle of the treatment line. Treat in an even straight line, overlapping one needle at each insertion site to ensure a continuous cold zone. Additional pressure may be needed, particularly with larger patients. For the infrapatellar saphenous nerve, start at the top and continue treatment inferiorly. Clinicians may also choose to begin treating in the middle of the treatment line. During treatment, patients may feel pressure along the treatment line, which is expected. Regardless of where you begin treating, the important thing is to keep track of where you've treated and treat until the target nerve is blocked. Ask for feedback from the patient throughout the treatment. Patients may feel an altered sensation, such as tapping or pressure, that is more intense when the targeted nerve is being treated. Continue the treatment cycles until the patient no longer feels these sensations. Palpate the painful areas you identified before treatment to assess pain now. At the end of the treatment, immediately apply digital pressure to the treatment line using gauze. This can help reduce bruising. You may also choose to use ice therapy to help reduce swelling. Then clean and bandage the area. Record the patient's pain after treatment. Have them perform the same mobility assessment, whether that was rising from a chair or going up and down stairs, and assess their pain levels now. Then review your post-treatment instructions with them.